Okay, we're doing shared motherhood today. I'm going to really go through basics, okay? So what is it? So it's an increasingly popular type of fertility treatment for same-sex couples that allows both members to contribute to having a family. So up until now, that's probably been one of the main barriers for same-sex couples because it's only ever one person that's involved. So one member of the couple will donate her eggs to her partner, who will then carry the pregnancy, and then vice versa as well if they want to. It can be done with a known sperm donor or an anonymous sperm donor, and I would say generally anonymous is far more common because a known sperm donor is more of a lengthy process with various testing and things for the man. And then it's important to note that the member of the couple that carries the pregnancy, so is the birth mother, is legally always classed as the mother of the child. So some more specifics. So more often than not, the member of the couple donating her eggs will go through IVF treatment and then freeze all the viable embryos. The other member of the couple carrying the pregnancy will then have a frozen embryo transfer. So what are these things? So the biological mother undergoes an IVF cycle, which is from about day 2 of their period. They'll take ovarian stimulation medication for roughly about 10 days. And in that time, she'll have regular scans and regular blood tests to monitor the growth of these follicles. And then when she's ready, she'll have her egg collection procedure, which is a minor procedure under a light sedation, where all eggs they can possibly get, they will try and retrieve. And then these eggs are fertilized with the donor sperm. They generally stay in the lab and monitored by the embryologists for about up to 5 days before they are then frozen. Now, the reason I've said that generally they'll freeze all the embryos before then having a frozen embryo transfer is because IVF in general is a really time critical process throughout the menstrual cycle. So more often than not, both members of the couple aren't going to be on their period at the same time. So they'll do the IVF treatment, freeze the embryos, and then come back and actually have the frozen embryo transfer. So the frozen embryo transfer process is less invasive. It's more about looking at the endometrium, which is where the embryo will implant, making sure it's nice and thick and has a great blood flow before they have a minor procedure, which is again less invasive than the egg collection, to put the embryo in and hopefully become pregnant. So both members of the couple have to complete all necessary pre-testing. So that is a baseline pelvic ultrasound scan and virology blood testing. And this is important as well if they're not doing treatment at the same time, because the IVF clinic labs are really strict on when the virology blood test is done, and they have to start treatment within 3 months of having the blood test. And then as the member of the couple of the IVF treatment, so the biological mother will be classed as an egg donor. She would have to complete donor blood tests prior to treatment and on the day of her egg collection. So legalities. So there's quite a lot of a legal process involved. In IVF in general, there are many legal consent forms to consider. So I would say when I previously worked in a fertility clinic, it would be about 60% of my job. And in shared motherhood, there are even more consent forms to consider because donation is involved. So there has been a history of court cases where couples have ended their relationship, sometimes when the birth mother is pregnant or after pregnancy. And there's been accusations of having eggs or embryos stolen because the consents were signed for the biological mother to donate the embryos to the birth mother. Now, being married is really important in this instance as well, because if they are not married, then the biological mother has rights to her embryos. But if they are married and they've signed consent forms to donate, then this takes precedence, and it would be a more lengthy process if they then ever broke up and would have to go through court proceedings and things. So for that reason, it's strongly advised for couples to have fertility counselling before they start the shared motherhood process. But that is also easier said than done to tell couples at initial consultations, because they obviously don't foresee breaking up. So we can obviously offer the pelvic ultrasound scan through Ultrasound Direct, and then the AMH test result on our report would be transferable to fertility clinics. Our FA calls, we can provide advice regarding the treatment process and then the preconception lifestyle advice that we always ask them to implement to optimize fertility. Then the one-to-one nutritional support with our lovely M to hopefully optimize fertility as well. And then lastly, we can then refer them to Apricity for treatment.